The following portion of Bloom is sponsored by Tampa Bay Breathe Free Sinus and Allergy Centers.
A lot of people don't realize sinus issues are directly linked to hearing issues. That's right. If you're suffering from allergies and other sinus problems, it won't just impact your breathing, it can leave you with muffled hearing. Joining us now with more is ear, nose, and throat doctor Mariah Pate. Welcome to Bloom, doctor. It's great to see you again.
Good to see you as well.
So there's actually a condition known as ETD. What does that stand for?
So ETD stands for Eustachian tube dysfunction. And the Eustachian tube is a tube that connects the ear to the throat and allows the ear to depressurize and drain and be healthy.
So if there are issues and people think, oh, I have sinus problems, they don't realize that that's actually impacting the way they hear.
Absolutely. So at the back of the nose is where the Eustachian tube is located. And so when you have sinus drainage or sinus congestion, it can cause that tube to get blocked and swollen. And so that can lead to things like muffled hearing. It can lead to ear fullness. It can lead to pain, ringing, recurrent infections. It really manifests in many different ways, and it's confusing for patients because they're concerned because it's their hearing.
Yeah, so how do people know that they actually have a problem?
So, the symptoms I mentioned, that's the first place to start. So if that happens and it happens for more than a few days and you can't open your ears or you can't pop it. So when you go on a plane and you pop your ears, you go over a mountain and you pop your ears, you want to try to do that. And if you can't, or if it still feels muffled or you're having trouble, then you want to go see a doctor. And so ENT specialists are the first people to usually go to for a problem with the ears.
Well, I know you're a leading ENT specialist in our area, so what are some of the treatment options that you offer your patients?
So there's multiple different levels of treatment. So of course the first is doing medical therapy like nasal sprays. Sometimes people need antibiotics, but many times more therapy is needed. So sometimes that's procedural. So the first option is doing a dilation of the Eustachian tube. It's a minimally invasive procedure where I actually go through the nose to open up the tube. It stretches it, it makes it healthy so the ear drains the way it should. And sometimes if there's a lot of fluid in the ear, sometimes we also have to make a hole in the eardrum, but that's much more invasive.
So I know a lot of folks just continue to suffer because they don't think that there's relief in sight. But if you leave this untreated, it can really impact your life in so many ways.
It can. So, if you do have untreated Eustachian tube dysfunction, it can lead to problems with the middle ear. So it can lead to recurrent infections. It can lead to abnormal skin growth in the ear. It can lead to hearing loss. And just, it makes you feel crummy. You feel like you're underwater. You can't hear. You can't interact. You can't have that social interaction. And there's some studies showing that hearing loss can actually lead to things like dementia and progressive cognitive decline.
Yeah, there are a lot of studies that link hearing loss to that, which is very alarming. So the best thing you can do is come to you and get a screening, find out what's going on.
Yeah, absolutely. So when you come to the office, we're able to get you an answer that day, be able to do a full physical exam and a workup to get you a plan.
Well, we're glad you're right here in Tampa Bay. Thank you so much for joining us, doctor.
Thank you.
Absolutely. And if you would like to schedule an appointment with the Tampa Bay Breathe team, call right now, 727-379-2201, or visit their website, tampabaybreathefree.com. We'll be back with more Bloom right after this.
The preceding portion of Bloom was sponsored by Tampa Bay Breathe Free Sinus and Allergy Centers.